So if you're turning 65 and Medicare is in front of you, or perhaps you're past 65 and you delayed the signing up of Medicare because you kept working past there, and Medicare is still in front of you, and you got to make some decisions. And this is the video to watch, which covers all the issues. So I want to bring Tom on, and I want Tom to share just exactly why we're doing this video.
Yeah, I mean, we're doing this video because everyone in this country who turns 65 faces this question. Should I sign up for Medicare? How does Medicare work? And it's very confusing. If you picked up the guide, and we have this in the show notes, I'll show you in a second, and you try to read through that and understand how it works, you're going to walk away more confused than you started. And so what we want to do today is really give you sort of the guide to all of Medicare, all the options, really break it down sort of piece by piece so you can walk away from this video, hopefully having a better understanding of what faces you when you get there, what decisions you have to make, what's best for you. And so let me bring up the show notes here. I will warn you, they're quite long today, so we're not going to go through all of them. Like normal, you can find these below the link of our video. They're also on our website on there, cardinalguide.com. We have the boards today. Actually, we're going to have two boards too, because there's more information that we can fit on just one board. So we got the first board, we got the second board. We'll get to that a little bit later in the video. And then we have this Medicare and You book, this guide as part of the show notes. This is something that you get in the mail when you're turning 65. Our show notes are 182 pages long, including the boards. So it's quite lengthy. We have the contents, we have the index options, so index of topics. So you can go look through, find a certain area and go find it in this guide. But again, it's very long. And so I would not start with this guide. Don't start there trying to learn all this. You need to watch the video first. You're going to have a lot more context of what you're looking at on that guide. But again, that's what the government gives you to try to teach you how this works. And it's just, you, like I said, you're going to walk away more confused than you started. And so the goal today is really just to give you some guidance there. And so Hans, I'm going to turn it back to you with sort of the question of, I'm turning 65. I'm still working. Do I need to sign up for Medicare or not?
Okay, that's a good start to the whole video. And the answer is maybe. So, turning 65, let's just pretend it's 4 months from now. So, July 1st, or during July is your 65th birthday. It's now March of 2024. And so, you're still working, you plan to keep working, or your spouse is still working and you're not working, but you're relying on your spouse for group insurance, which you're very happy with. Do you have to sign up for Medicare, or can you delay until your spouse retires? So it's a little complicated. That's a good question, Tom, and we're going to just go through, give you the outline of the whole video. Is we've come up with 3 questions that you need to get answered, and we're going to answer them for everyone today. And if you want to get in touch with us and engage us for consulting around Medicare, these are the 3 questions that we're going to ask you. And it's very important that you do these in the proper order. So, do you sign up for Medicare at 65 or do you wait? Second question is, once you sign up for Medicare, do you want to stay on original Medicare, or do you want to go to a Medicare Advantage plan? And that's an either or question. And then the third area is, once I've gotten signed up for Medicare and once I've chosen which direction I want to go, is original Medicare plus a supplement or Medicare Advantage, now I've got to get into the insurance presentation, and I got to start talking to people and looking at companies, looking at plans, looking at my needs. And unfortunately, a lot of my compadres that are in the Medicare consulting business, and they're basically selling Medicare insurance, they start right here on number 3, and I'm going to tell you which insurance company to buy from, mine, and buy this plan, and they're going to just show it to you and sign you up. And without a lot of proper work, this can get people in some pretty bad spots. So let's just dig in and let's talk about what is original Medicare. Okay, original Medicare is Part A, which is your hospital and skilled nursing. It comes to you at no monthly cost. So you've paid taxes all along. And when you get to be 65, you can sign up for Part A, even if you're still working, and costs you nothing. Okay. And the coverage that you get is quite extensive. So if you go in the hospital for 60 days or less, the only out-of-pocket cost you have under original Medicare is a deductible of $1,632. That means you could have a $100,000 hospital bill, and they're going to Medicare itself. Original Medicare is going to pay like $9,800 out of it, plus a little change. So Part A can be a simple decision at 65, but there's a couple of catches down here that I'm going to talk about. And then Part B is your doctor and outpatient. And, I just had some knee surgery about a month ago. That's why I'm carrying this cane around. And, I never went in the hospital. I mean, I went there to the operating room or into the beginning room and then into the operating room, into the recovery room. And I walked out of the hospital and haven't been back since. So, and I am on Medicare. That was all a Part B expense. So Part B is a little simpler. It's your doctor and outpatient. And you have an annual deductible of $240 under original Medicare. Means the first $240 you pay. After that, Medicare is going to cover 80% of their approved charges. You would be responsible for 20% of the approved charges, plus any charges that weren't approved. Okay, but that's pretty extensive coverage. Where the weakness in it is there's no cap on the 20% that you pay. And so, you could have a $100,000 hospital bill and Medicare pays 80,000 of it, you're out 20,000. I mean, there's no upper cap on that. That's why, along with Medicare Part A and Part B, you need a Medicare supplement if you're going to stay on original Medicare. We're going to get into that later in the show. So that's Part A and Part B. And Part B is going to cost you $174.70 a month. And that's money paid to the government. And if you're already on Social Security, they're going to take it out of your Social Security check. If you're not on Social Security, you're going to have to pay the bill. And that's going to be 93% of you that are on Medicare are going to have to pay for $174.70 for Part B. The other 7% of you are going to fall into this thing called IRMA. And IRMA, we have other videos on IRMA. So if you're a high income in retirement person or even a high income before retirement, you're going to fall into this pay extra. So you're going to pay more. You're going to possibly pay a lot more than $174.70 a month. So that's one of the reasons, and there's others, of why if you're still working and you get group insurance, you don't want to sign up for Medicare if your group insurance is creditable. And you just don't, because you can save that money, and then you're also going to delay your open enrollment. Your spouse falls under the same thing. And we have people, and I'll let Tom come in and ask me the question that we get from a lot of the customers. What about those penalties? So Tom, why don't you just come on and ask that like you're an incoming customer?
Yeah. So, I mean, Hans, I hear you. Well, what about these penalties? I mean, I know that if I don't sign up, I'm going to have these penalties. They're lifetime penalties. I'm really worried about that. What should I do?
You need to be very careful for this. It's a great question to be asking, because if you get this wrong and you don't sign up and then you later want it, you're going to face delays in getting Medicare, and you're going to be assessed a penalty, and that penalty is for life. So I'm not just telling everybody here, hey, if you're still working, or your spouse is still working, don't sign up for Medicare. Now, it's not that simple, because you're going to want to make sure that you have creditable group insurance from work. Okay, Medicare, it's almost like they invented a word. It's creditable, not credible, but creditable. And so, and what that simply is an employment arrangement. You work there, there's a group insurance plan, and there's 20 or more employees. So it's a large corporation. And if that's there, the coverage will be creditable And then we can help you with that, with a form to verify that it's creditable. And a lot of people say, oh, hey, I want the form. I want to delay. Well, you don't send in the form at turning 65. You just come to us. We can look it over. You can get the consulting. But if you have creditable coverage, you just go on relying on your group insurance. And then when you're 68 or 69 and retire, then at that time, you're going to have to prove to Medicare that you've had creditable coverage. And we have a form for that. We do it all the time for people. So most people that work past 65 do not need to sign up for Medicare. They have the option to sign up for Part A, but handle it lightly. Now, when I say the option for Part A, you just say, well, why wouldn't you want to sign up for Part A if it has no monthly cost? Well, if you're covered under a group insurance and you have a health savings account, an HSA, that you pay into, and you sign up for Medicare, even Part A, you can no longer contribute to your health savings account. And if you do, you can have some problems with that. So, generally speaking, if you're going to not sign up for Medicare Part B, and you're covered under group insurance and you got a health savings account and you intend to continue it for you or your spouse, you're going to want to just avoid signing up for Part A so that you can continue on the group insurance. And there's several details with that. We have other videos on all these subtopics. So if you really want to dig in and learn, you can go throughout the channel. We're trying to give you a general overview, and we're trying to answer question number one. Now, what the alternative to original Medicare is a Medicare Advantage. And we're going to talk about that in the next part on the second board. And we want to talk about it, but I'm going to bring it up here because you can't get Medicare Part C unless you're already signed up for original Medicare Part A and Part B. So we're getting into the second set of decisions, but a lot of people think when they go to Medicare Part C that they're able to, when they do that, they're able to get out of this $174.70 a month, and it's just not true. Is that you got to sign up for Medicare Parts A and Part B, and then once you have that as an alternative to buying a supplement, you're going to outsource your Medicare over to one of these Medicare Advantage plans.
I'm going to add a couple more things before we switch to the other side of the board
Okay.
here. I want to point out a couple things on that creditable coverage piece is that needs to be active employment. So retiree coverage does not count. You need to be currently working for them. COBRA does not count. ACA coverage, individual coverage that you're buying on your own, that doesn't count. It's a very specific thing that you are actively employed or your spouse is, and you have health insurance from a company with 20 or more employees. If the answer to that is no, you need to sign up for Medicare when you turn 65. So, like Hans, we have less than 20 employees at Cardinal here. He turned 65 this past July. He had to sign up for Medicare. He was not able to delay it. He had to go on and sign up for that. And then the penalties, back to that penalty piece there is, you're going to get a lot of mail when you turn 65. You get very popular, all sorts of things are coming in the mail. And on a lot of them, they'll say, beware of these penalties. Watch out for these penalties. You need to sign up now. And I can't tell you how many clients we've had that I've talked to. We've had this conversation. They've told us, and I've told them very clearly, you have credible coverage. You don't need to sign up. And they get to their birthday and they say, I know you've told me, I just want to check again. Are you sure I don't need to sign up? And the answer is no. If you have the 20 employees, you work for a company with 20 employees, you do not need to sign up. Now, you still might want to. It might be worth looking at it, look at the benefits, the cost, but you don't have to. And so I just want to ease some people's concerns because, it's worrisome. You start looking at these letters saying you're going to have penalties for the rest of your life. People hate that. They don't want to pay any penalties if they can avoid it. And so just take some, hopefully I can provide some level of comfort. If you have coverage that's credible, you don't need to sign up for Medicare.
Okay, now we're going to move on to the second question, which is, do I want to stay on original Medicare, which is Part A and Part B? And do I want to, if I stay on that, do I want to buy a Medicare supplement And the answer to that is if you're staying on original Medicare, you need to get a supplement because it's too much liability and exposure. So, and then we're going to talk about the supplements in the next section and answer it. So are we wanting to stay on original Medicare and buy a supplement, or do we want to take our original Medicare and do we want to turn it in to a Medicare Advantage? And we do that by authorizing a private insurance company like Humana, like United Healthcare, like Cigna, like Aetna, and all the big ones, that what you're doing when you purchase one of those is you're taking your Part A and your Part B, which is coming directly from the government, and you're outsourcing it, or you're electing to receive it from a private insurance company. And you're going to make this decision because you're going to get more benefits out of the thing by doing that. You say, well, why wouldn't I want to do that? Well, there's some stop signs. We're going to go over those. But I want you to get in this decision that we really need to make this before we start signing up for a plan, because it's real confusing if we don't. So we can research both sides, not having made this decision. So you can get down into the third question, which is what company and what plan, for a bit, but then you still got to go back and make this what is a binary decision. It's this way or it's this way. Okay, there's no going down both roads. So let's have a little review quickly. Original Medicare is Part A and Part B. You're paying no monthly cost for the Part A. The Part B is $174.70 a month. And then in addition to that, if you're part of the high income group, which is about 7% of the Medicare recipients, you're going to pay more than $174.70 a month, as much as $600-700 a month for Medicare because of IRMA, because of your high income. So we have other videos on that. I suggest if you do fall under IRMA or it's an exception, that you would engage somebody or us for consulting, and we can kind of walk you through that and look at your own situation and see if there's anything you can do about it. But original Medicare is Part A, Part B, and then what you're left with this, if you just stay on original Medicare, there's very few people that do this, but some do. You got the exposure of 20% of all the Part B charges, and there's no cap on that. So if you spent several $100,000 in medical bills, this could wipe you out, just the 20%. So you're going to want to do something about that. And the something you can do is just purchase a Medicare supplement, or some people call these Medigap, that's going to pay that 20% and runs other deductibles as well. Or you're going to take this Medicare, original Medicare, and you're going to turn it into a Medicare Advantage plan. Okay. So if we want to look at these Medicare Advantage plans, what we really need to think about is the positive of that is many of these have a zero premium. So they're going to charge you nothing and give you more benefits. That's very attractive. And some people get confused because they think that they get out of the Part B premium. And that's not the case. Is you have to have Part B to get a Medicare Advantage, and you still have to pay that to the government, but you won't be paying the individual Medicare Advantage company. In some cases, it's a zero premium. So that's very attractive. You're going to get dental added on, vision added on a lot of them. You're going to get a drug plan added on. And then there's a bunch of things like meal plans, rides to the doctor. There's a whole lot of things. I mean, these are the things you hear Joe Namath talking about on TV, or Joe Montana, or the commercials with the celebrities. And they're talking about all these extra benefits, and they're staying away from the basics of Medicare. And you really, but this is insurance. And so the extra benefits are fine, but you really want to be evaluating the health insurance coverage that you're getting, because that's the thing that's going to pay the lion's share of your medical bills. So why would you not want to go on a Medicare Advantage plan? And what I would say is one big reason is most of them have a network. It means that you got to go to their doctors and their hospitals, and plan to their rules. And if that's okay with you, I mean, I don't want to describe that like it's awful, because there's a lot, we sell a lot of these to people. They want them and they're fine with dealing with the network, and they've had a network on their group insurance. Just want to be clear, that can present a problem when you become seriously sick and you want to start seeing specialists around the country, or you want to go to a research hospital. These things generally don't travel well. You spend part of the year in Florida, or part of the year in Texas or Arizona, and part of the year somewhere else. Then you've got two sets of network problems. So there's disadvantages. That's the biggest one. The second one is that the deductibles and copayments, although they're smaller than original Medicare, they can add up over time. So a lot of folks that can afford it, that go on original Medicare, they go this direction and looking at the Medicare supplement. So I want to bring Tom on and just have him, before I jump over on Medicare supplements, I want to see if Tom's got something to add to the Medicare Advantage thing.
I mean, the Medicare Advantage, it's a lot of times those are the ads you're seeing on TV, and they do talk a lot about the extra benefits you get, which are nice benefits, right? The benefits in and of themselves are not bad. They're nice to have those. But you need to make sure that you understand what decision you're making, because oftentimes people have decided, like an agent has come out or someone has called on you, and they're either a Medicare Advantage person or they're a Medicare supplement person, and they don't tell you both options. They just tell you the option they have. Typically they start with the company you should buy it with. If someone comes to me and says, what company should I buy for Medicare first? That's like a big red flag right off the bat, because we need to have more conversations. You need to do these in the right order. You need to, one, do you even need Medicare? Then we need to make the decision of which path we want to go, Advantage plan or supplement. And then we get down to the company. So we'll get to that question here in a second. But the Medicare Advantage are not bad. But like Hans was saying, the networks can be problematic. Like when I got sick, if you've watched our channel, I got sick back in 2018, and I went up to the Mayo Clinic to get tested. They ran a bunch of things for me, and I ended up being diagnosed with an autoimmune disease. But I know the Mayo Clinic does not take Medicare Advantage plans, even out of network. And so, if you're on that and you have something seriously happen and you want to go see some of these special doctors, special hospitals that maybe focus on whatever area you're looking at, that might become a problem if you have the Medicare Advantage plan. And so they're not bad coverage. It's better coverage than what we have as our group coverage right now. So they're not awful plans. But if I had the choice to go to the supplement, and I'm in a unique situation where I know I have monthly expenses because I get monthly infusions that are $10,000 a month. So I would go the supplement route because I know I'm going to be maxing that thing out every year. But one of the reasons that you might consider the Advantage plan as opposed to going that, like Hans was saying, is the premium is less, like the zero cost is very attractive. And there's a max out of pocket, right? There's a cap on what you could spend in a year. That's why you'd want to do that over just sticking with original Medicare and not getting a supplement. So that's a little bit of context there, but I'll turn it back to you, Hans. We'll talk more about the supplement path here.
Okay, so now we're looking at the other side of the second question, is staying on original Medicare, adding on a Medicare supplement. Okay, and so we want to look at, like, why would you want to do that? Why do you not want to do that? Okay, and the example that we have up here, and we chose a male, age 65, who's single. And we did that because that's going to be the most expensive it's going to be. I mean, some states charge women and men the same price, but most states charge the women less for Medicare supplements than they do the men. The men just cost more to insure. And then most states and companies give a couple's discount. Some companies will even give it to you just if you're married or you have a partner that you reside in the same household. They'll give you the discount even if that partner doesn't buy a supplement. So they got all different rules. So we just went with a single person simply because we're going to quote the highest cost to give you examples. And then we use the plan G. That's like G like gum. And the letter G here in the example of the Medicare supplements has nothing to do with Part A, Part B, Part C, and Part D. Okay. I mean, it's just the government, just to make things more confusing, they label everything by letters. And so people just mix this together like alphabet soup. With the letter G, the reason we use G is it has the highest level of benefits of all the 10 standardized Medicare supplement plans. So I was actually in the business 30 some years ago in 1990 when the government standardized these policies. And they said, all right, we're sick of you insurance companies. You got this policy, you got that policy, and then your salespeople go out and sit down and say, we got this bell and whistle and makes our policy better. And then the other company comes back and says, well, yeah, we can add this and we can add this. And it was very confusing. It still is. But what they did is they said, these are the 10 policies you can sell. Here are the benefits on them. You go ahead, insurance companies, and price them. And we're going to label them A, B, C, so on and so forth. There's 10 of them. They've changed a little bit over the years. But I've always been one to sell the highest benefit Medicare supplement. Once you're going to go here and you're going to go private with your Medicare supplement to go along with your original Medicare, I mean, why would you want to then cut out benefits? Because all it does when the policies get less expensive is you take one benefit that's away from the G, you knock it off, and you got another lettered plan. You take another benefit and kick it off, you're at another lettered plan. So for the purposes of today, we're going to go over the G, which is the best one. And when you get in touch with us, if you want to, we can go over some of the other plans and show you the differences and why you might want one of them. But this is going to give an across the country comparison of the G plan. And so I'll talk about open enrollment in a second. And so what I've done is I've listed 5 companies. There's actually in most states about 40 different insurance companies offering exactly the same G plan. And so if I showed those would take a whole board. And I don't think that would just add confusion. So I took the 5, really what are the largest companies in the business. They write the most business, and 4 of them are also the biggest players in this Medicare Advantage business, which just adds to the confusion. Because if you're looking at Aetna, are you looking at an Aetna Plan G Medicare supplement to go with original Medicare? Or are you looking at one of the many plans that Aetna offers on the Medicare Advantage side? It just gets confusing. So we're over at Medicare Supplement, we're on the Plan G, and we're looking at 5 companies across the country. And I've got North Carolina, Texas, California, Illinois, Florida, and New York. And I would tell you that North Carolina is one of the lowest priced areas for Medicare Supplement in the country. They're maybe not the lowest, but they're of the big states. And then New York is definitely the most expensive. And then some of the companies don't even play there. But I've also highlighted in blue the least expensive Plan G. And so, in North Carolina, it's a tie with Mutual of Omaha and Cigna. They're going to write you a Plan G for $126 a month. Texas, it's, and now in Texas, if you go into the semi-rural areas or rural areas, you're probably going to get prices like you have in North Carolina. But I went to the most expensive place in each state. So then again, I was overstating premiums instead of understating them. And this is Houston, but you can buy from Humana for $142 a month. In California, it's AARP United Healthcare, $155 a month. In Illinois, it's $139 a month for AARP. In Florida, again, AARP is the winner, $251 a month. And keep in mind, these are all offering exactly the same benefits. And then in New York, it's $306 a month for the least expensive one, which is United Healthcare. And we do represent all 5 of these companies, plus many more in most states. And we're in all 50 states in the District of Columbia. We're licensed and can do business there. So when we actually run an illustration for you, we may come up with one that's less expensive, even though you're in one of these states, because you're either married or you live in a different place within there. Um, I want Tom to come on and just talk about the rate calculator that we have on our website, where you can actually run these reports.
Yeah, I mean, we have this place on our website. You go there; it's right there on the front page under the Medicare section of our website. And what's nice about it is you can run this report without having to give us any of your information. Right? You start googling Medicare quotes, you're going to have a whole bunch of Google hits on that. But all of them, I shouldn't say all of them. Most of them are going to require you to put in your name, your phone number, your email address, and then you're going to get hounded by people trying to sell you stuff. On our site, you don't put any identifiable information. You put in your zip code. You put in, do you want to run a G quote, how old you are you male or female, and you hit go, and it will give you the list right there. So we don't know who you are. We don't know that you ran it really at all. And so it's a way to get the information. You can do a little bit of research on your own before you come talk to us. Now, hopefully you then reach out and we can help sell it to you, but you don't have to. It's not a requirement. And so what's nice, one thing I just want to point out with the supplements too, and Hans mentioned this, a G plan is a G plan is a G plan, no matter who you get it from. So you look at this chart and you'll notice like these prices are pretty different from every company. You're like, well, why is it way more expensive on one company than the other? The companies they get to choose their pricing. So what's not standardized is the cost, but the benefits are identical. So a G plan, I mean, I could look at that and tell you definitively what your benefits are without even knowing the company name. And so just I want you to keep that in mind, because if you have one of these, maybe you pick Beach of Omaha when you first turning 65 and it works great for the first 3-4 years, but the price has gone up because all of these will go up over time. We might look at switching you to another supplement, something that's maybe with Aetna at that point or Cigna, whoever has the less costly one at that point, and you're switching to the exact same benefits. If you're getting a G plan, it's identical. So I just want to point that out because a lot of people miss that. A lot of people don't realize that. And it becomes, people love the way these benefits work, especially if you get sick. You start realizing how great this insurance is, and they never want to leave. They say, man, I want to stick with this company forever. And it's not really the company. I mean, the company, yes, is paying the claims, but it's the G plan standardization makes it, you could switch to another one and you'd have the exact same coverage.
Okay. So you can shop for this stuff, and there's still people that work in the Medicare supplement business that only sell for one company. And so they come out and see you and they present it to you. And here's our Medicare supplement, and here's the cost, sign you up. But I'm going to tell you, you can ask them, what lettered plan is this? And a lot of people, I mean, I would, if somebody was presenting it to me, I would say, where does your cost fit in the spectrum of companies selling the same lettered plan? You can go to our website and you can fact check them, and you can see where their company fits in the, in the scheme of things. Secondly, um, I, I would just want to see that from people. Some people will, some of these folks that are selling this stuff, if they have limited options, they'll talk to you about a different lettered plan. They'll say, oh, no, you don't want a G, you want an N plan. And then they'll talk about the N plan, or they say, you don't want a G, you want a D plan. Or they're going to move you to a different place on the chart, and perhaps they've figured out that their D plan looks the most favorable, and then you're giving up plans over the G. So there's many ways to kind of work around this. We believe in just disclosure of all the information and all the options to people. So that is the Medicare supplement combined with original Medicare. And we get through this second decision, and then we get down to the third decision. And the third decision is, which one of these companies do I want to buy a plan from? And we can go back with the Medicare Advantage, do the same thing. Now, Tom and I are both CFPs, Certified Financial Planner, and we have other CFPs working with us here at Cardinal. We have a CPA working with us at Cardinal, and a lot of our business is retirement planning. We do a lot of Medicare business, and this is a great product for people to kind of get a taste of our consulting. And I want to just go over a couple more things that may be of interest to you because of the fact that you're turning 65 or you're in that sign up for Medicare. One is Social Security sign up. this is where you're going to go to sign up for Medicare, is to Social Security. And if you haven't found this out already, is full retirement age is not 65 anymore. It's fast approaching 67. So the people born in 1958, it's 66 and 8 months, and the people born in 57, it's 66 and 6 months. 59 is 66 and 10 months, and then the people born in 1960 or after, it is actually age 67. And that matters to you in terms of your Social Security decisions. You can start as early as 62 for Social Security. You can delay it as long as 70. We recommend, when you're making this decision, that you do it within the context of a whole retirement plan. Obviously, if you don't need the money, in many cases for the larger check, it's better to delay. So we can help you with that too. We want to talk about the standalone 401k IRA, where you've got people have money in there, and if they're going to retire, they need to turn that into an income. We can help them with that too. We're in the life insurance business. People want to plan their estate. Perhaps they want to use life insurance to do that. We're in the long-term care business. Medicare doesn't do much for long-term care. And I omitted earlier talking about the Part D plan. And there's really not much to say there, but we help people shop for those, and we offer most of the plans, and we have a computer program that we're going to use depending upon your area. So I want to bring Tom back on and just kind of summarize and talk about add any more thoughts.
Yeah, I mean, I think this video is longer than our typical video, but there's a lot that you have to go through. And I think you would just point us back to sort of those first three questions. And you really need to take this decision in that order. And so, first question, do I need to even sign up for Medicare? And the answer might be no. And oftentimes we are recommending people not sign up for Medicare, at least not yet. But once you've made the decision to sign up for Medicare, you go to question number two, is which path on Medicare do I want to go? Do I want to go the Medicare supplement route? Do I want to go to the Medicare Advantage route? And that's an either or decision. You can't have both. You can't have a little bit of benefits from a supplement, a little bit of benefits from an Advantage plan. It does not work that way. So you got to make that decision first. And then the final decision, which at some level is going to be the easiest one, once we've made those first two decisions, is which company you go with. And that's really where you start looking at who has the best price. If we're going the Medicare Advantage route, are your doctors in network? What is sort of the copays when you go to use it? I mean, there's a lot of things that go into that decision, but that needs to be the last decision, right? If you don't go through those first two decisions before you get to that last decision, you might end up in the wrong spot. So, if someone's talking to you about Medicare and they haven't gone through those first two questions yet, you probably want to take a step back and go through those first.
Okay, in this area around the board, we've got 240 videos up there on our YouTube channel, Cardinal Advisors. So if you want to look around, you're going to find videos on all these topics. Today, the whole video has been about Medicare and getting signed up for it. We also talked about Social Security. We talked about long-term care. We talked about 401k IRA. We didn't really talk about retirement income, and we didn't talk about estate planning, other than we talked a little bit about life insurance, and certainly income tax planning is not on there. So I want to bring Tom back on. I'm Hans Scheil.
And I'm Tom Griffith.
And we thank you very much for listening.
Thank you.